If you are over the age of 60 and you have been taking vitamin D because someone told you it was good for your bones or good for your heart or good for your immune system, I want you to hear something very clearly right from the beginning. The problem is not that you are taking vitamin D. The problem is that most seniors were never taught how vitamin D actually behaves in an aging body. You were given a name, a pill, and a dose, but you were not given context. And without context, even good intentions can quietly work against you. Vitamin D is not just a vitamin in the way most people think of vitamins. It does not simply fill a gap and then step aside. Vitamin D acts more like a signaling molecule. It communicates, it instructs, it influences, and in seniors, signals matter more than substances. Younger bodies are flexible. They compensate. They adapt. Older bodies are not broken, but they are more literal. They respond exactly to the messages they receive, and they respond for longer periods of time. That means timing, balance, and consistency matter far more after 60 than they ever did before. Many seniors take vitamin D faithfully for years and feel disappointed because nothing seems to change. Blood pressure stays stubborn, sleep feels lighter, stiffness creeps in, or lab results look normal but the body does not feel settled. This leads people to assume vitamin D does nothing, or worse, that aging itself is the only explanation. But often, what is really happening is not failure, it's misalignment. Vitamin D's primary job in the body is not to strengthen bones. That is a result, not a mission. Its real job is to regulate calcium behavior. It tells calcium when to be absorbed, where to circulate, and how aggressively to move. Calcium is powerful. It makes muscles contract. It helps nerves fire. It stiffens structures when needed. But calcium must be controlled carefully, especially in seniors. Too little calcium weakens. Too much calcium in the wrong place stiffens. Vitamin D is the traffic signal. When that signal is mistimed, unclear, or unsupported, traffic does not flow smoothly. This is why vitamin D never acts alone. It always works in relationship with other systems. It interacts with kidney function because kidneys activate vitamin D. It interacts with magnesium because magnesium allows vitamin D's signaling to occur properly inside cells. It interacts with the nervous system because vitamin D influences stress response and circadian rhythm, and it interacts with blood vessels indirectly because vessel flexibility depends on proper mineral balance and hormonal signaling. None of this is dangerous by default, but none of it is simple either. Many seniors were told, just take it in the morning with breakfast. That advice was never individualized. It was convenient, but convenience is not precision. Vitamin D sends a biological signal that resembles a daytime message. In some people, that signal supports alertness and metabolic activity. In others, especially seniors with sensitive sleep cycles or cardiovascular systems, that same signal can subtly interfere with nighttime recovery if mistimed. Blood pressure is not meant to stay the same all day and all night. It is meant to rise gently during activity and fall during rest. That nighttime lowering, often called the dipping response, is one of the most protective processes the cardiovascular system has. Anything that interferes with that process deserves attention. This does not mean vitamin D is harmful. It means vitamin D must be respected. Some seniors feel more settled taking it earlier in the day. Others feel better spacing it away from sleep. What matters is not the rule, but the response. Seniors were rarely told to observe response. They were told to obey instructions. That's a critical difference. Another misunderstanding that causes quiet problems is dosage rigidity. Some seniors take very small amounts for years, never reaching a level that meaningfully supports their physiology. Others take higher doses without monitoring, assuming because vitamin D is common, it must be harmless. The truth sits in the middle. Vitamin D accumulates. It builds slowly and clears slowly. That means adjustments should be gradual and guided by observation and testing, not guesswork or fear. Testing vitamin D is not about chasing numbers. It's about understanding trend and stability. Seniors benefit more from steady, moderate levels than from extremes. The body values consistency. Sudden spikes and drops are stressful. A calm, predictable signal allows systems to relax. That relaxation is where healing and balance occur. Many seniors also worry about calcium because they hear conflicting messages. One day, calcium is essential, the next day, it's dangerous. The truth is simpler than the headlines. Calcium is necessary, but calcium must be escorted. Vitamin D opens the door. Other systems decide where calcium goes. When those systems are supported, calcium strengthens bones and supports muscle function. When those systems are strained, calcium can linger where it does not belong. That is not something to fear, it is something to manage thoughtfully. This is why aging does not require more supplements. It requires better conversations. Seniors do not need hype. They need clarity. They need permission to move slowly, to ask questions, to notice how their own body responds, rather than following generic advice designed for younger metabolism. If you have been taking vitamin D for years and nothing dramatic has happened, that does not mean you failed. It means your body may be asking for alignment rather than escalation. If you recently started vitamin D and feels subtly different, that does not mean something is wrong. It means your system noticed a signal and is responding. Observation matters more than reaction. Vitamin D is not a cure. It is not a replacement for medical care. It is not a shortcut. It is a support tool. When used thoughtfully, it can gently assist systems that are already working hard. When used carelessly, it can add noise instead of clarity. Seniors deserve better than noise. So if there is one idea I want to leave resting in your mind as you listen to this, it's this. Your body after 60 is not fragile, but it is precise. It listens carefully, it responds honestly, and it benefits most from calm, consistent signals rather than strong, abrupt ones. Vitamin D is one of those signals. When you understand that, you stop treating it like a pill and start treating it like a message. And messages, when timed and delivered properly, can change how the whole system behaves. One of the healthiest things a senior can do is slow down their interpretation of changes. Instead of reacting day by day, observe week by week. Patterns reveal themselves over time. Blood pressure readings fluctuate naturally. Sleep varies. Energy ebbs and flows. Vitamin D's influence is gradual and cumulative. Looking for instant confirmation only creates frustration. It is also important to say this clearly. Vitamin D is not a substitute for medical care. Seniors should never feel they must choose between supplements and their doctor. The best outcomes come from integration, not opposition. A thoughtful physician appreciates an informed patient who notices patterns and asks grounded questions. There's a quiet empowerment that comes from understanding your own signals. When you notice how timing affects sleep, how consistency affects mood, how small changes accumulate, you stop feeling at the mercy of your body. Instead, you feel in conversation with it. That relationship is one of the greatest gifts of aging, when approached with curiosity rather than fear. If you're listening to this and thinking, I wish someone had explained this years ago, that feeling is valid. Many seniors were never given this level of context, but it is not too late. The body remains responsive well into later decades. It simply responds best to patience. Vitamin D is one of the gentlest places to practice that patience. It teaches you to observe, adjust, and respect your body's pace. Those skills extend far beyond one supplement. They influence how you eat, how you rest, how you manage stress, and how you age overall. One of the most difficult adjustments seniors face is learning to trust slow improvement. Modern life trained many of us to expect immediate feedback. You take something, you feel something. You change something, you see something. Aging physiology does not operate on that schedule anymore, and that mismatch alone creates unnecessary worry. Vitamin D is a perfect example of this mismatch because its effects are quiet, indirect, and cumulative. When seniors say, "I don't feel anything from vitamin D," that statement is usually true and also misleading. Most of what vitamin D influences happens below conscious sensation. It influences gene expression, cellular signaling, inflammatory tone, and mineral balance. You don't feel those processes happening, any more than you feel your liver filtering blood. Yet those background processes shape how your body responds to stress, sleep loss, illness, and aging itself. This is why it's important not to judge vitamin D by dramatic sensations. Feeling energized or relaxed is not the goal. The goal is resilience. The goal is that your system handles everyday stress a little more smoothly than it did before, that your blood pressure recovers faster after activity, that your sleep is slightly more restorative over time. These changes are subtle, but they compound. Another misconception seniors often carry is that aging automatically means decline no matter what you do. That belief becomes self-fulfilling. While it is true that some systems slow down, many systems remain adaptable far longer than we once believed. The endocrine system, which includes vitamin D signaling, remains responsive well into later life. But responsiveness requires consistency, not force. Consistency does not mean obsession. It means not changing 5 variables at once. Seniors sometimes start vitamin D, then change diet, then add new supplements, then alter sleep schedules, all within a short period. When something feels different, it becomes impossible to know why. That anxiety breeds anxiety. Anxiety raises blood pressure more reliably than almost anything else. A calmer approach is more effective. One change, time to observe, gentle adjustment if needed. This approach respects the body's need for clarity. It's also worth addressing a quiet emotional factor. Many seniors fear making mistakes because they feel they no longer have buffer. Younger people believe they can bounce back. Seniors feel consequences more acutely, so they hesitate. That hesitation is understandable, but education replaces fear with confidence. Understanding how vitamin D works reduces the fear of doing it wrong. There is no single right way that applies to everyone. There is only a thoughtful way, a way that involves awareness, communication, and patience. Vitamin D is forgiving when used gently. Problems usually arise from extremes, extreme doses, extreme expectations, or extreme rigidity. Let's talk about rigidity for a moment. Many seniors were taught to follow instructions exactly, without deviation. That mindset worked well in many areas of life. But biology is not a checklist. The body responds to patterns, not rules. If you miss a dose, nothing breaks. If you take it at a slightly different time, the system adjusts. What matters is the long-term pattern, not daily perfection. This perspective alone relieves a great deal of stress. Stress, again, is a major driver of vascular strain. When seniors feel constantly worried about doing health wrong, the nervous system remains on alert. Vitamin D cannot override that alert state. No supplement can. Calm understanding is part of the treatment, whether anyone calls it that or not. There is also value in reframing expectations. Instead of asking, "Is this lowering my blood pressure?" a better question might be, "Is my body handling pressure better?" That difference matters. A number is a number. A system response evolves. Blood pressure readings are influenced by posture, hydration, emotion, recent activity, even conversation. Seniors often measure, worry, remeasure, and worry again. That cycle itself raises readings. Vitamin D works in the background, not in the moment of measurement. Evaluating it requires stepping back and looking at trends over weeks and months. Another under-discussed factor is seasonal rhythm. Seniors often notice they feel different in winter than in summer. Vitamin D levels naturally fluctuate with sun exposure. Supplementation can help smooth that fluctuation, but it does not erase seasonal biology. Expecting identical feelings year-round creates frustration. Supporting natural rhythms instead of fighting them leads to better outcomes. The body likes rhythm: sleep rhythm, eating rhythm, light-dark rhythm. Vitamin D interacts with all of these. When rhythms are respected, signals align. When rhythms are chaotic, signals compete. Seniors benefit enormously from simplifying rhythms rather than complicating routines. There is something deeply reassuring about routine at this stage of life. Taking something at the same time, in the same way, with calm intention, sends a message of safety to the nervous system. That message alone lowers stress hormones. Lower stress hormones means lower vascular tension. This is how indirect effects matter. If you take nothing else from this long discussion, take this. Vitamin D is not about fixing you. You are not broken. Vitamin D is about supporting balance in a system that has carried you through decades of life. Respect that system. Listen to it. Work with it rather than trying to command it. Aging well is less about control and more about cooperation. Supplements like vitamin D are tools for cooperation, not weapons against aging. There is also something that happens psychologically as people age that rarely gets discussed in medical conversations, yet it shapes everything about how health information is received. Seniors have lived through multiple eras of certainty. They've been told butter is bad, then good. Eggs are dangerous, then harmless. Sun exposure was encouraged, then feared. Supplements were ignored, then promoted, then questioned again. After decades of reversals, trust erodes, not just in advice, but in one's own ability to decide. That erosion of confidence quietly affects the body. When you are unsure, the nervous system stays vigilant. Vigilance raises baseline tension. Baseline tension raises blood pressure, disrupts sleep, and increases inflammation. No supplement can fully compensate for that state, vitamin D included. This is why clarity matters more than complexity for seniors. Not more information, better framing. Vitamin D should not feel like another confusing rule layered onto an already crowded mental space. It should feel like a simple support woven into daily life. One reason fear-based messaging spreads so easily is because it offers certainty. You're doing it wrong. That sentence is powerful. It creates urgency, but urgency is not what aging bodies need. Urgency belongs to emergencies, not long-term health. Seniors do best with steadiness. When someone hears you're taking vitamin D the wrong way, what often happens internally is not curiosity, but tension. The shoulders tighten, the breath shortens, the mind jumps ahead to consequences. That reaction alone undermines the benefit of whatever information follows. A calmer framing would be, there are gentler, more effective ways to support your body with vitamin D as you age. That invites learning. Modest support is undervalued in modern culture, but modest support sustained over time is what allows seniors to maintain independence, stability, and quality of life. Vitamin D fits that model well when approached correctly. It is also okay for seniors to decide that good enough is enough. Perfect adherence, perfect timing, perfect numbers, these are not prerequisites for benefit. The body does not require perfection to respond positively. It requires reasonable consistency and a low-stress environment. Low stress does not mean a life without challenges. It means not turning every health decision into a source of anxiety. Vitamin D should not be another thing to worry about. It should be one of the simpler pieces. As this conversation continues, notice how nothing here demands urgency. There is no countdown, no warning clock. That is intentional. Aging well is not about outrunning time. It is about settling into it. And within that settling, small supports like vitamin D can quietly do their work, day after day, week after week, without fanfare, without fear, without pressure. There is also something that happens psychologically as people age that rarely gets discussed in medical conversations, yet it shapes everything about how health information is received. Seniors have lived through multiple eras of certainty. They've been told butter is bad, then good. Eggs are dangerous, then harmless. Sun exposure was encouraged, then feared. Supplements were ignored, then promoted, then questioned again. After decades of reversals, trust erodes, not just in advice, but in one's own ability to decide. That erosion of confidence quietly affects the body. When you are unsure, the nervous system stays vigilant. Vigilance raises baseline tension. Baseline tension raises blood pressure, disrupts sleep, and increases inflammation. No supplement can fully compensate for that state, vitamin D included. This is why clarity matters more than complexity for seniors. Not more information, better framing. Vitamin D should not feel like another confusing rule layered onto an already crowded mental space. It should feel like a simple support woven into daily life. One reason fear-based messaging spreads so easily is because it offers certainty. You're doing it wrong. That sentence is powerful. It creates urgency. But urgency is not what aging bodies need. Urgency belongs to emergencies, not long-term health. Seniors do best with steadiness. When someone hears, "You're taking vitamin D the wrong way," what often happens internally is not curiosity, but tension. The shoulders tighten, the breath shortens, the mind jumps ahead to consequences. That reaction alone undermines the benefit of whatever information follows. A calmer framing would be, there are gentler, more effective ways to support your body with vitamin D as you age. That invites learning instead of fear. Fear narrows attention. Calm widens it. Seniors deserve wide attention. They deserve context, nuance, and respect for lived experience. Another subtle but important point is that aging bodies prioritize conservation. They hold on to minerals differently. They process hormones differently. They protect equilibrium fiercely. Vitamin D enters that system as a signal, not a command. If the system senses instability, poor sleep, emotional stress, inconsistent routines, it dampens responsiveness. Again, this is protective, not pathological. Many seniors interpret this dampening as nothing works anymore. That belief is heartbreaking and unnecessary. What's really happening is that the body is asking for safety before cooperation. Once safety is restored through routine, reassurance, and patience, responsiveness returns. Safety can be as simple as predictability, waking at similar times, eating regular meals, gentle movement, familiar environments. Vitamin D works best inside that predictable container. Without it, the signal gets lost in noise. It's also important to talk about the social context of aging. Many seniors experience reduced social interaction. Loneliness alters physiology. It increases stress hormones and inflammatory markers. Vitamin D cannot substitute for connection, but it may help buffer the physiological effects of isolation when used as part of a broader supportive lifestyle. Listening to something like this, slow, repetitive, explanatory, is itself a form of regulation. It mirrors how the aging nervous system prefers information, unhurried, reassuring, layered. That's not a weakness, that's wisdom. The body has learned that rushing leads to mistakes. Another thing seniors often underestimate is how much their bodies remember. Past injuries, illnesses, stress periods, they leave traces. Vitamin D interacts with those traces subtly. It may not erase them, but it can soften their impact over time. Again, this is not dramatic, it's quiet improvement. Quiet improvement is easy to miss if you're only watching for big changes. That's why journaling, or simply reflecting weekly, can be powerful. How was my sleep this week compared to last? Did I recover from activity a bit faster? Did I feel steadier emotionally?
These questions align better with how vitamin D actually shows its value. There is also dignity in aging that gets lost when health conversations become alarmist. Seniors are not fragile objects that will shatter with one mistake. They are resilient systems that have adapted repeatedly across decades. Vitamin D does not suddenly become dangerous because you took it wrong. The body is far more forgiving than internet headlines suggest. Forgiveness is built into biology. The liver adjusts, the kidneys adjust, hormonal feedback loops adjust. That doesn't mean recklessness is wise, but it does mean fear is unnecessary. Calm attention is the middle path. One of the most empowering shifts a senior can make is moving from "am I doing this right?" to "how does my body respond over time?" That shift restores agency. Agency lowers stress. Lower stress improves outcomes across the board. So when we talk about vitamin D for seniors, we are really talking about a larger philosophy of aging well. Slow inputs, gentle signals, consistent patterns, respect for rhythm, trust built over time. This is not glamorous. It doesn't sell quick fixes, but it works. And it works not because vitamin D is magical, but because the body, when treated with patience and understanding, still knows how to find balance.
There is also something else that deserves attention here. As people age, they often become more sensitive, not weaker, but more attuned. They notice when something feels off. They notice when advice doesn't quite sit right. They notice when their body resists something that should be helping. This sensitivity is not a problem to fix. It is information. For many seniors, health guidance has felt loud for too long. Too many instructions, too many warnings, too much urgency. When the nervous system hears urgency repeatedly, it doesn't feel motivated, it feels pressured. Pressure tightens the body. Tightness raises strain. Strain affects sleep-wake cycles, circulation, digestion, and yes, blood pressure. So even well-meaning advice can backfire if it carries the wrong tone. That's why this conversation intentionally stays calm, because the delivery matters just as much as the content. For seniors, the most effective guidance often sounds like reassurance rather than instruction. You're not broken. You're not behind. Your body is still capable of adapting. Those messages lower internal resistance. Lower resistance allows regulation. And regulation, over time, is what the body responds to. Now, when we talk about vitamin D in this context, it's important not to turn it into another point of pressure. Not another thing to get right. Not another rule to memorize. Not another reason to worry you're doing something wrong. Instead, think of it as one quiet support among many. It works best when it fits naturally into your existing rhythm, not when it disrupts it. And this is especially important later in life, when routines provide more than convenience, they provide stability. Stability tells the nervous system, you are safe. And safety is the foundation of healthy regulation. Many seniors already have strong intuitive routines, even if they don't label them as such. Morning light, a familiar breakfast, a certain chair, a certain time of day when the body feels most settled. These patterns are not accidental. They are self-regulating behaviors developed over decades. Any health recommendation that ignores these patterns is likely to fail, not because the person is non-compliant, but because the body resists disruption. So instead of asking, how do I change everything, a better question is, what already works and how do I support it? Support does not need to be dramatic. It needs to be consistent. Consistency for seniors is not about strict schedules. It's about familiarity. Doing something at roughly the same time, in roughly the same way, with roughly the same emotional tone. That emotional tone matters more than most people realize. A supplement taken with tension sends a different signal than one taken with ease. The body does not just register substances, it registers context.
We remain here, moving slowly, staying grounded, allowing understanding to deepen without pressure. There is something reassuring about predictability, especially later in life. It tells the nervous system that nothing unexpected is required of it. When the nervous system senses safety, it stops scanning for threats. Heart rate softens. Breathing deepens naturally. This is not something that needs to be forced. It emerges on its own when conditions allow. Many seniors notice that when evenings are calm and familiar, sleep arrives with less effort. Not instantly, but more willingly. Sleep is not a switch. It is a process. And processes respond to consistency more than intensity. The same principle applies to nearly every long-term health-supporting habit. Big gestures tend to fade. Small, repeatable gestures tend to stay. This is why advice that sounds dramatic often fails in the real world. It may be impressive, but it is rarely livable. Livability matters more than theory. For seniors, the question is rarely, is this effective in a study? The real question is, can I live with this comfortably for years? Years matter, because the body responds to what is done over time, not to what is done briefly. There is wisdom in choosing approaches that feel sustainable rather than heroic. Heroic efforts exhaust. Sustainable efforts support. Support allows the body to settle into a steadier baseline. A steadier baseline means fewer extremes. Fewer extremes mean less strain. Strain is often invisible. It does not always announce itself with pain or alarm. Sometimes it shows up as tension, or restlessness, or a feeling that the body never fully powers down. Reducing that background strain is one of the most meaningful gifts seniors can give themselves. It does not require adding more tasks. It often requires simplifying existing ones. Simplification is not giving up. It is refining. Refining routines so they cooperate with the body instead of competing with it. Refining expectations so they match current needs rather than past capacities. This refinement process is deeply personal. No two people age the same way. No two nervous systems respond identically. That is why rigid rules tend to fail over time. They leave no room for listening. Listening allows adjustments that feel respectful rather than restrictive. Respect matters. Especially self-respect. Many seniors have spent years putting their own needs second. Caring for others. Meeting obligations. Following instructions. Later in life, there is an opportunity to shift that dynamic slightly. Not towards self-indulgence, but towards self-attunement. Attunement means noticing how the body responds. Not judging it. Not correcting it immediately. Simply noticing. Noticing creates space. Space allows choice. Choice restores a sense of agency. Agency is calming. A calm mind supports a calmer body. This is why tone matters so much in health-related conversations for seniors. A rushed tone can feel dismissive. An alarmist tone can feel overwhelming. A steady, respectful tone invites engagement without pressure. That is the tone we remain in here. Nothing is being demanded. Nothing is being rushed. Nothing is being fixed. We are simply allowing understanding to mature at its own pace. Pace is not an obstacle. It is a resource. A slower pace gives the body time to integrate. It gives the mind time to settle. It gives emotions time to align. Alignment is subtle. But when it happens, things feel easier without needing explanation. Easier mornings. quieter evenings, more predictable nights. These are not dramatic outcomes. They are valuable ones. So we remain here, continuing calmly, letting the message breathe, letting repetition do its quiet work. There is nothing more to do in this moment. Just stay present. Stay receptive. We remain in this space because it allows the body to stay open rather than alert. Alertness has its place. It helps us cross a street. It helps us respond to emergencies. But alertness is not meant to be constant. When it becomes constant, it quietly drains resilience. Many seniors live with a low level of ongoing alertness without realizing it. Not fear. Just readiness. Readiness to manage medications. Readiness to respond to appointments. Readiness to handle interruptions. Over time, this readiness becomes the background setting of the nervous system. It feels normal because it has been there so long. But normal does not always mean optimal. The body thrives when it knows there will be predictable periods of release. Times when nothing is expected of it. Evenings can become one of those periods. When they are protected and consistent. Protection does not mean isolation. It means gentleness. Lower stimulation. Familiar cues. The body reads cues constantly. Light levels. Sounds. Timing. These cues inform internal processes more powerfully than most people realize. They tell the body whether it is time to mobilize or time to restore. Restoration is not passive. It is active work carried out quietly. Cells repair. Hormones recalibrate. Systems communicate. This work happens best when signals are clear and consistent. Conflicting signals create confusion. Confusion does not cause immediate problems. It causes inefficiency. Inefficiency over time can show up as fatigue, or restlessness, or a sense that the body never fully resets. Reducing inefficiency is often more achievable than chasing improvement. Improvement sounds ambitious. Efficiency sounds practical. Practical approaches tend to last longer. Later in life, energy becomes more valuable. Not because there is less of it, but because it is needed for things that matter more. Relationships. Enjoyment. Presence. Anything that quietly preserves energy without demanding effort is worth attention. This is why small, well-timed habits can have an outsized impact. They don't compete with daily life. They blend into it. Blending is important. When a habit feels separate, it feels optional. When it feels integrated, it becomes automatic. Automatic does not mean careless. It means established. Established habits require less decision-making. Less decision-making reduces cognitive load. Reducing cognitive load is especially supportive for seniors. The mind appreciates fewer choices. The body appreciates fewer demands. This creates space. Space to notice comfort. Space to notice ease. Ease is not laziness. Ease is efficiency without strain. Strain often goes unnoticed until it accumulates. Ease tends to be noticed only when it's gone. Reintroducing ease is rarely dramatic. It happens through subtle shifts that align better with natural rhythms. Rhythms do not need explanation. They need consistency. That consistency does not have to be perfect. It only has to be frequent enough for the body to recognize it as dependable. Dependability builds trust. Trust calms internal systems. Calm allows regulation. Regulation is the foundation beneath many aspects of well-being. When regulation improves, other processes follow quietly. There is no need to monitor every signal. No need to analyze every sensation. The body is capable of adjusting when given clear, repeated cues. Clear does not mean loud. Repeated does not mean constant. It means familiar. So we keep this tone familiar. We keep this pace unhurried. We allow the message to settle without forcing resolution. Nothing here is moving toward an ending. There is no finish line in sight. We remain in the middle, where understanding deepens gradually, and pressure stays low. There is something deeply stabilizing about knowing that nothing new is being demanded. No decision required. No action expected. Just presence. Presence is underrated in conversations about health, especially for seniors. Yet presence is often the condition that allows the body to recalibrate on its own. When the mind is no longer racing ahead, and no longer reviewing what should have been done differently, the body senses a rare opportunity to soften. Softening is not collapse. It is release. Release of tension that has been held so long it no longer registers as tension. Many seniors are surprised to discover how much effort their bodies have been carrying quietly. Not dramatic effort. Just constant low-level holding. Holding posture. Holding schedules. Holding expectations. Even holding the idea that one must always be on top of things. Over time, that holding becomes invisible. But the body still feels it. When holding eases, even slightly, there is often a sense of relief that cannot be traced to a single cause. A lighter breath. A slower heartbeat. A sense that the day is not pushing quite as hard. These changes do not announce themselves. They whisper. Whispers are easy to miss when life is loud. But when the pace slows, whispers become audible. That is one of the reasons long, uninterrupted conversations like this matter. They create a quiet environment where subtle signals can be noticed. Not analyzed. Not judged. Simply noticed. Noticing without judgment is a skill that often strengthens later in life. It comes from experience. From having seen that not everything needs immediate correction. Sometimes observation alone changes the outcome. The body responds differently when it feels observed with kindness rather than scrutiny. Scrutiny tightens. Kindness loosens. Loosening supports circulation, respiration, and restfulness. Again, this is not about dramatic shifts. It is about allowing systems to operate without constant interference. Many seniors intuitively sense that less interference often leads to better outcomes. This intuition is well earned. After decades of trying to optimize, adjust, correct, and manage, there is a growing recognition that support often works better than control. Support is quieter. It does not argue with the body. It collaborates. Collaboration requires listening. Listening requires time. Time is something this conversation deliberately offers. There is no rush to reach a point. No pressure to arrive at a conclusion. This is intentional. Long stretches of steady input allow the nervous system to remain in a receptive state. Not defensive. Not skeptical. Receptivity is where learning happens most naturally. Especially for seniors whose bodies value safety over novelty. Safety does not come from certainty. It comes from predictability. Predictability in pacing. Predictability in intention. That is why the cadence remains even. Why the message circles rather than advances aggressively. Circling allows different layers of understanding to emerge at different times. One idea may land now. Another may settle later. Nothing is wasted. Even if attention drifts momentarily, the rhythm remains steady enough for re-entry. This matters for older listeners, whose attention may move fluidly between listening and reflecting. Reflection is not distraction. It is integration. Integration takes time. And time is respected here. So we continue, remaining grounded, remaining patient, remaining present. No conclusion forming. No summary approaching. Just continued space for the body and mind to absorb at their own pace. We continue without changing direction. Nothing new is required from you. Nothing needs to be remembered perfectly. The value here is not precision. It is familiarity. Familiarity tells the nervous system that it is safe to remain open. When something feels familiar, the body stops bracing. Bracing is subtle. Many people do not notice it until it releases. Shoulders drop slightly. The jaw loosens. Breathing becomes quieter. These are not dramatic shifts. They are small signals of permission. Permission to rest without guilt. Permission to listen without needing to act. For seniors especially, guilt can linger in unexpected places. Guilt about slowing down. Guilt about needing reminders. Guilt about not doing things the way they used to. This space carries no such expectations. There is no comparison being made. No standard being applied. Only acknowledgement. Acknowledgement that the body you inhabit today has carried you through decades of living. It has adapted again and again. Quietly. Reliably. Adaptation does not stop with age. It simply becomes more selective. The body learns which signals matter and which can be ignored. That discernment is a form of wisdom. It deserves respect. When information is delivered slowly, with repetition woven gently into the flow, the body recognizes it as non-threatening. That is why ideas are revisited. Not because they were not understood, but because understanding deepens with each pass. Think of it like walking a familiar path. Each time, something different stands out. The path does not change. You do. This is why long-form listening works well for older audiences. There is room for memory to surface, for associations to form naturally. No pressure to keep up. No fear of falling behind. You are exactly where you need to be. As this steady rhythm continues, the mind may drift and return. This is normal. Drifting is not disengagement. It is the mind's way of processing gently. When it returns, the voice is still here. The tone is unchanged. Consistency builds trust. Trust allows information to settle deeper than words alone. It allows the body to participate in listening. The body listens differently than the intellect. It listens for safety, for sincerity, for steadiness. Those signals remain constant here. So we continue at this measured pace, layer by layer, without urgency. There is no ending approaching yet. No wrapping up. No final takeaway being delivered. Just continuation. And in that continuation, the body has time to recalibrate. The mind has time to soften. And understanding is allowed to emerge naturally. We continue, without signaling an ending. At this stage, what matters most is rhythm. Rhythm reassures the body that nothing unexpected is coming. For many seniors, unpredictability is more tiring than effort. The body can work. What it resists is surprise. So the flow remains even. You may notice that the voice does not rush to explain, does not push toward instruction, does not demand agreement. That is intentional. When information arrives gently, the mind has space to sort what feels relevant from what can be set aside for later. Nothing here insists on being remembered word for word. Only the feeling of steadiness matters. Steadiness is something the body recognizes immediately. It recognizes it the way it recognizes a familiar room, or a familiar chair, or a familiar time of day. There is comfort in knowing what comes next will sound much like what came before. That comfort allows attention to stay present longer. As minutes pass, and the voice continues at the same pace, the nervous system often shifts into a listening state. That is deeper than focus. This is not concentration. It is receptivity. Receptivity is where learning settles in without strain. For older listeners, this kind of listening often feels like sitting with someone trusted. Someone who is not in a hurry. Someone who is willing to stay. Staying is important. So many messages today arrive quickly and leave just as fast. They skim the surface and move on. This does the opposite. It stays long enough for the body to relax into the sound of it. If the mind wanders briefly, that is part of the process. When it returns, the same tone is waiting, the same pacing, the same sense of calm continuity. Nothing has been missed that cannot be rejoined. This is how longer understanding forms. Not through urgency, but through exposure over time. Exposure that feels safe. As this continues, some listeners may notice a subtle slowing inside themselves. A feeling that the day is less compressed. That is not imagination. That is the nervous system responding to predictability. Predictability allows the body to stop scanning for threats. When scanning stops, energy is conserved. Conserved energy supports rest, digestion, and clarity. Again, nothing dramatic. Nothing forced. Just a gentle shift toward balance. That is why there is no rush to summarize. No need to conclude. The continuation itself is the value. So we remain here. Voice steady. Pace unchanging. Allowing the message to continue unfolding naturally. And we keep going. We continue, staying exactly within the same rhythm. Nothing new is introduced suddenly. Nothing shifts sharply. This consistency matters more than it may seem. For seniors especially, consistency allows the body to stop monitoring. Monitoring is tiring. It consumes energy quietly. When monitoring fades, the body redirects that energy toward maintenance and repair. This is why slow, continuous narration has a physical effect. Not just a mental one. You may notice that breathing becomes more regular without trying. That is a sign the nervous system feels unpressured. There is no expectation to respond. No need to agree. No need to remember everything. Just listening is enough. Listening at this pace allows ideas to pass through gently, rather than striking and bouncing away. Think of it like sunlight through a window. It does not demand attention. Yet over time, it warms the room. This warmth is subtle. It builds gradually. Older bodies respond well to gradual change. They have learned that sudden shifts are rarely helpful. Gradual change respects what has already been lived. As the voice continues, it remains predictable. Predictability creates trust. Trust allows the body to remain open longer. Remaining open does not mean vulnerable. It means receptive without strain. There is strength in that. You may notice moments where attention drifts inward. Memories may surface. Thoughts may wander briefly. This is not interruption. It is integration. Integration happens quietly. It does not announce itself. That is why there is no attempt here to pull attention back forcefully. The voice stays steady, so returning feels natural. This rhythm respects the way seniors process information. Not linearly, not urgently, but relationally. Each phrase connects gently to the next. Nothing stands alone. Connection builds comfort. As comfort grows, the body often releases small tensions it did not realize it was holding. A softer forehead. A slower swallow. A deeper exhale. These are signs of settling. Settling does not mean stopping. And ongoing. We continue, exactly as before. There is no need to check where we are. No need to measure progress. This is not a path with milestones. It is a steady walk with no destination announced. That absence of destination allows the body to remain relaxed. When there is no finish line, there is no pressure to perform. Performance is exhausting, especially later in life. What remains when performance drops away is simply being present with sound, with pacing, with continuity. Continuity is comforting. For many seniors, continuity feels like familiarity. And familiarity signals safety. Safety is the condition that allows listening to continue effortlessly. As this voice carries on, notice that it does not compete with your thoughts. It does not ask them to leave. It does not ask them to stay. Thoughts are free to come and go. The voice remains regardless. This is important. When listening does not require effort, the mind can rest even while receiving information. Rest and learning can coexist. This is often forgotten. Older listeners often learn best when they are not trying to learn. When learning happens indirectly, through repetition, through tone, through rhythm. That is what is happening here. Nothing is being rushed. Nothing is being condensed. Time is being allowed to stretch. As minutes pass in this steady flow, the nervous system remains in a neutral state. Not alert. Not drowsy. Neutral is ideal. Neutral is where absorption occurs. You may feel moments of quiet alertness, followed by moments of gentle drifting. Both are welcome. There is no correct way to listen to this. There is no wrong way either. Listening is happening simply by being here. This is why the voice does not rise to emphasize urgency. Why it does not drop to signal closure. There is no urgency. There is no closure. Only continuation. Continuation allows the body to settle into a long-term rhythm. Short bursts stimulate. Long stretches stabilize. Stability matters, especially for seniors, whose systems value consistency over novelty. Novelty excites. Consistency sustains. This is sustaining. As the sound continues, the pace remains even. The spacing between phrases remains generous. These pauses are not empty. They are intentional. Pauses give the body time to respond internally. Not consciously. Physiologically. The heart rate often adjusts slightly during quiet listening. Breathing may deepen without awareness. These are natural responses to steadiness. Again, nothing dramatic. Nothing forced. Just gradual alignment. So we remain in this flow. No ending language. No summary approaching. The voice stays present. The pacing stays slow. The continuity remains intact. And we continue on. Exactly like this. We continue, staying within the same gentle current. Nothing has shifted. Nothing needs to shift. This sameness is not repetition for its own sake. It is reassurance. Reassurance tells the body that it does not need to prepare for change. When preparation stops, strain eases. Strain often hides in small places. Behind the eyes. In the neck. Across the chest. As listening continues at this pace, those areas often soften without instruction. Softening is a response, not a task. You are not being asked to relax. Relaxation happens when pressure is absent. Pressure is absent here. The voice does not demand attention. It simply remains. Remaining is powerful. Many seniors have spent years responding to demands. Appointments. Schedules. Responsibilities. This space is different. Here, nothing is required in return for listening. No agreement. No action. No decision. Just continuation. As this steady rhythm carries on, the mind may notice how rare it is to encounter something that does not escalate. Most messages build toward a point. This one does not. That absence of escalation allows the nervous system to settle deeper. Deeper settling does not mean sleep. It means ease. Ease supports clarity later. Even after listening ends. Though we are not approaching an end now. We are still within the middle of the flow. Middle spaces are often overlooked. Beginnings get attention. Endings get emphasis. The middle is where the body actually adapts. Adaptation happens quietly. It does not announce itself with sensation. It shows up later as steadiness, as patience, as resilience. These qualities matter deeply in later life. That is why this narration does not rush forward. Why it does not gather itself toward a conclusion. It honors the middle. As the voice continues, you may notice a sense of time becoming less sharp. Minutes feel less defined. This is another sign of settling. When time softens, the body is no longer tracking. Tracking consumes energy. Restoring energy requires letting go of tracking. This flow encourages that gently. Nothing here needs to be measured. Not progress. not comprehension. Just presence. Presence is enough. So we continue on. Still steady. Still unhurried. Still open. No conclusion forming. No wrap-up language appearing. Only continuation. Quiet. Consistent. Ongoing. We continue, without changing course. The steadiness remains. The tone remains. There is comfort in knowing that nothing sudden will happen here. That comfort allows the body to stay present without effort. Effort is not required for listening at this pace. Listening becomes passive. Almost like resting with sound in the background. That is intentional. For many seniors, passive listening is where understanding settles most deeply. Not through focus, but through familiarity. Familiarity builds quietly. As the voice continues, it stays within a narrow emotional range. No spikes. No drops. This narrow range is soothing to the nervous system. It avoids stimulation and avoids boredom at the same time. Balance matters. Balance is not something to chase. It emerges when extremes are absent. That is what is happening here. The mind may notice that it does not need to anticipate what comes next. There is no surprise waiting. Anticipation relaxes when predictability is present. Predictability does not mean dullness. It means safety. Safety allows the body to remain open longer than excitement ever could. As this flow continues, attention may come and go naturally. This is expected. There is no need to pull it back. And familiarity tells the body, especially as that it is exactly as to let go, is not weakness. There is no need to check where we are. It no longer requires attention. No need to measure progress. The sound can drift into the background. This is not a path with milestones. It can coexist with a steady walk with no destination or with no thoughts at all. That absence of destination allows the body to remain relaxed. Just a natural, quiet there is no finish line. That arrives there is no pressure to perform. Remain here just as long as is exhausting. Or move for many later moments like this are rare. When what remains right, when performance drops away, quiet does not mean is simply without urgency. Nothing is happening without correction. Sometimes the most continuity. Continuity is recognizes when it is allowed to rest. For many seniors, continuity feels like familiarity. That familiarity signals safety, not to teach. It does not announce the condition that allows listening to continue, not to conclude again. Doing nothing more to maintaining continuity. Notice that it does not until quiet feels complete on its own. Let that go. It does not ask there is nothing coming next. It does not ask them that you need to prepare for. Thoughts are free to come and go. This is not a test. When the listener no longer sound. This is an instruction period. When listening does not require effort, the rhythm remains the mind can rest even while receiving information remains gentle, rest and learning nothing more is sometimes even uncomfortable in this calm extension. So the voice exists. The narration simply holds as a companion when they are not steady, respectful, predictable, when learning happens indirectly, and unhurried, allowing the moment to no surprises, through no urgency. Through the voice may notice your jaw unclenching. That is what is not to add information. You may notice your tongue resting, but to maintain steadiness. Instead of pressing against, there is no rush to arrive anywhere. Time is being allowed to stretch. No finish line the nervous system as minutes pass in this steady flow. Nothing needs to be done about them. The nervous system allow your shoulders to soften. Not about listening while lying down, not about tomorrow. Let the weight of your body sink to the past. Neutral is where absorption occurs. Without nothing needs to be adjusted. Thoughts do not require answers to be followed by moments in of this gentle drifting. This part of the narration they is both are welcome. To feel like
there is no correct
someone.
way to listen
The
to this.
pacing
Who
remains
does not
slow.
expect
There is no
conversation
wrong
because
way
aging
either.
bodies
Just
respond
presence.
best.
Listening is happening simply
Take a
by
slow
deep breath
breath
through the nose.
This is
Fast
why the voice
transition
does
does
not
not
demand
the body
energy
naturally.
urgency.
Slow
Why
continuity
it does not
preserves
drop
it.
to signal closure.
That is
enough.
why this voice,
There is no
as
urgency.
the voice does not rush to
There
end.
is no closure.
You may
If your
notice
breathing
moments
feels
only
shallow,
continuation,
where your
that
attention
is
drifts.
okay.
Continuation allows the
If
body
it
to
feels
settle
deep,
into a long-term rhythm.
drifting
That is
is
also
a sign
a
that
short
the
bursts
nervous
stimulate.
Nothing is being
is no
measured.
longer on
Stretches
alert.
stabilize.
This continuation
If your mind
exists. Stability
wanders,
matters.
So your
There is
system
no
does
need
not,
to
especially
bring
for
it back.
seniors, abandoned
The
by
word
silence.
systems
Not
value
instructions now.
consistency
Voice
over
stays.
novelty. They are background.
Until you no
excites.
longer need
Simply
it.
sound.
Consistency
You might
sustains.
notice
For many older listeners,
that
this
the
is
words are
sustaining.
becoming
Constant
less important
instruction
as
can
the
feel
sound
tiring.
continues.
The rhythm. This section
pace
offers
remains
the optional.
even.
The
No
spacing
demand
between already
phrases
been
remains
delivered. No
earlier.
correction. Now,
These pauses
there
are
is
not
expectation
empty.
of remembering anything.
They
Tone
are
tells the
intentional.
body.
Just
time unfolding
Pauses
at a
give
gentle
the
pace.
body time to respond
And
internally.
any moment you feel drowsy,
Not
especially later in
allow
life,
that
physiologically
sensation
is more valuable.
There is
the heart
nothing
rate
here
often
than
adjusts
stimulation
slightly. That
during
requires
quiet
full
listening.
alertness. Breathing
We
may
allow
some
them
people
without
listen with
awareness
eyes
journey.
closed. These are
To
natural
come to a true
responses of
close.
steadiness.
Both
Not
are
because
again
anything
correct.
is
Nothing
missing.
dramatic.
There is no
Not
right
because
way.
something
forced
must be done
to
next.
be present
Just
here,
gradual
but because
alignment.
rest
The voice
also
will
needs an
continue
ending. So
in
we
the same
remain
rhythm.
in this flow.
That feels
steady.
steady.
No ending language.
If you stayed with this voice
no summary
and
approaching
calm
for a long time.
predictability
Voice
helps
stays
the
present.
body
Honor
relax.
The pacing
Sustained
stays
attention
slow.
is
No
not
surprise
easy.
is
The
coming.
continuity remains
Especially
intact.
so the
Later in
sentences
life,
remain
and we
simple.
continue
and
on.
especially in
The
a noisy
pauses
world.
remain
Exactly like
generous.
this. What you offered
If
here
you
was
notice your
time.
breathing
Staying
slowing
within
and
the
the
same
same
gentle
gentle
that is a
current.
natural response.
Before the
Nothing
sound
has
fully
shifted.
leaves.
If you notice your thoughts
Nothing
becoming
let's settle
quieter,
one
final understanding.
This sameness
also
is not
natural.
repetition
This
for its
entire
own
message.
sake.
Nothing is being forced.
It
about
is reassurance.
vitamin D.
This
continuation
about
about
aging
tells the body that it does
so
not
the
need to
ending does
prepare
not
for
feel
change.
sudden.
Was never
When
about
preparation
fear. Mind
stops,
does not ask.
strain
It was about
eases.
alignment.
Whether it is
strain
finished.
often
As we
hides
grow
in small
older,
Instead, it's simply
our bodies
behind
ask
the
for
eyes.
cooperation.
That it is
In
safe
the
to
neck,
stop
not
listening.
force.
Across the
Whenever
chamber
it
respond
wishes.
best. As listening
The
continues,
voice will not
disappear abruptly. To
Those
rhythm,
areas
it will
often
fade
soften
gently.
without
To
instruction.
instruction. The way evening
Whether
light
you
is a
change
response,
nothing,
not a task,
without
or whether
announcing
you
night,
make one
you are
small
not being
adjustment
until
to
that
relax.
happens.
You are not
Relaxation
behind.
happens
remains
when pressure
there
is
is no
absent.
race.
Calm,
Unhurried.
pressure
There
is
is no
absent
failure
here.
and supportive. The voice
Health
does
no
not
action
demand
required.
attention. You catch
no
simply
response
remains.
needed.
It unfolds
Remain
and
gradually.
now is powerful. Very
Just like
gradually.
many seniors
did.
have spent years
We allow
responding
this
to
long
long
conversation,
any of this information
to
later.
come to a natural resting
schedule.
place. Calmly. Not if you choose to
Responsibilities.
speak with a doctor.
Not
this
a sudden
space is
stop.
so
Different.
confidently,
But a conclusion that
nothing
feels
is
like
required
are
in
informed.
return for
The
listening
end of a
and
thoughtful
attentive
visit
to
to
no
your body,
agreement where nothing
and if you
urgent
choose
to
to
do
do
nothing at all today.
no
if you've been
decision,
listening
that is
for a
also
long time,
acceptable.
continuation.
Thank
Rest
yourself
is
for
not
that
as this steady
patience.
rhythm carries on.
Rest is
Long-form
part of
listening
care.
is
Mind
not
may
easy.
notice how
Now,
rare it is.
especially
Bring
as
your
we
attention
get older,
gently
something
back,
that does
and
not
especially
escalate
to
in
where
world.
you are.
Most messages
That if your
constantly
eyes are
rushes
closed.
us. This one
This
does
space
not
was
when it
created.
feels natural.
That absence
to
of
do the
escalation
if your body
allows the
feels
nervous
heavy
system to
now,
settle deeper.
as we
Take
close,
your time
deeper
moving.
settling does
Let's
not
quietly
there is no
revisit.
need to hurry.
It means
the most
this
important
narration
idea
is
ease
complete,
supports clarity
not as a
later.
nothing
more is expected
Even
of
after
you.
listening
instructions.
ends.
You may sit quietly
we
for
are not
understanding
approaching
an end now, or continue
Vitamin
with
D.
your
We are
day.
still
within the middle
For
of
many
the flow.
seniors,
Right. Middle spaces
not
are often
ineffective
overlooked
because it
does
not
for
work.
listening.
Beginnings
get
It
attention.
is
For
ineffective.
caring. Endings get
Before
emphasis.
staying
often
present.
taken. The middle is where the body
ways that
actually
do not
adapts. support. Adaptation
aging
happens
body's
quietly.
rhythms.
It does not
Absorption
announce
needs
itself with sensation and cardiovascular
It shows
balance.
up
later as steadiness. The body after
as
50
patience
is not the
as
same
resilience.
body. You had
These
at
qualities
30 matter deeply in later
Timing
life.
matters
more. That is why this narration does not
matter
rush
more.
forward.
Why it
Consistency
does not
matters
gather
more.
itself toward a conclusion.
And above all, It honors
How
the middle.
gently we work with the body
As the voice continues,
matters more.
you may notice a
force
sense
or
of time
dosage
becoming
alone.
less sharp. Minutes feel less defined. This is another sign of settling. When time softens, the body is no longer tracking. Tracking consumes energy. Restoring energy requires letting go of tracking. This flow encourages that gently. Nothing here needs to be measured. Not progress. Not comprehension. Just presence. Presence is enough. So we continue on. Still steady. Still unhurried. Still open. No conclusion forming. No wrap-up language appearing. Only continuation. Quiet. Consistent. Ongoing. We continue, without changing course. The steadiness remains. The tone remains. There is comfort in knowing that nothing sudden will happen here. That comfort allows the body to stay present without effort. Effort is not required for listening at this pace. Listening becomes passive. Almost like resting with sound in the background. That is intentional. For many seniors, passive listening is where understanding settles most deeply. Not through focus, but through familiarity. Familiarity builds quietly. As the voice continues, it stays within a narrow emotional range. No spikes. No drops. This narrow range is soothing to the nervous system. It avoids stimulation and avoids boredom at the same time. Balance matters. Balance is not something to chase. It emerges when extremes are absent. That is what is happening here. The mind may notice that it does not need to anticipate what comes next. There is no surprise waiting. Anticipation relaxes when predictability is present. Predictability does not mean dullness. It means safety. Safety allows the body to remain open longer than excitement ever could. As this flow continues, attention may come and go naturally. This is expected. There is no need to pull it back. This narration was never meant to pressure you into action, only to offer clarity, so that if you choose to take vitamin D, you do so informed, calmly, and safely. No supplement replaces medical care. No vitamin replaces a physician's guidance. But understanding allows better conversations. With your doctor, with your pharmacist, and with yourself. If there is one thing to carry forward from this time, let it be this. Your body responds best when it feels supported, not rushed. Whether you change nothing, or whether you adjust one small habit, that choice is yours alone. There is no deadline, no urgency. Health unfolds over time. Now, as we conclude, take one final slow breath in and let it go naturally. If you are seated, notice the support beneath you. If you are lying down, notice the ease in your body. This session is complete. Nothing more is required. You may remain here in silence, or you may move on whenever it feels right. Thank you for giving this time to yourself. The voice does not need to end all at once. Sometimes, especially for seniors, a gentle extension feels better than a clean stop. So we remain here just a little longer. Nothing new will be introduced. Nothing important will be added. This is simply space for the body and mind to settle after listening. If your eyes are closed, You may notice the darkness feels comfortable rather than empty. If your eyes are open, you may notice details in the room that were always there, but felt unimportant until now. This is what calm attention feels like. Not sharp, not focused, just present. For many people over 50, this kind of quiet awareness is rare. Life often asks for vigilance, medications, appointments, numbers, readings. Here, there are no numbers, no targets, no performance, just time passing, without demand. If your breathing feels deeper now, that is not something you made happen. It is something the body chose. Once it felt safe. Safety is the foundation of all healing conversations. Whether the topic is nutrition, vitamins, or long-term health, the body listens best when the tone is calm. That is why this voice slowed. That is why nothing was rushed. Information can be found anywhere, but reassurance takes time. If you carry anything forward from this extended moment, let it be permission. Permission to slow down decisions. Permission to ask questions later. Permission to care for your health without fear. Fear tightens the body. Understanding softens it. And softness, especially as we age, is not weakness. It is wisdom. The sound will now gradually fade into silence. You do not need to notice. When it happens, there will be no signal, just a natural quiet that arrives on its own. Remain here as long as you wish, or move gently back into your day when it feels right. The quiet does not mean nothing is happening. Sometimes the most important moments are the ones where nothing new is added. So the voice stays with you a little longer. Not to teach, not to persuade, not to conclude again, just to remain. If you notice a sense of waiting, let that go. There is nothing coming next that you need to prepare for. This is not a test, not a lesson, not an instruction period. It is simply continuation. For many seniors, silence can feel unfamiliar, sometimes even uncomfortable. So the voice exists as a companion, steady, predictable, and unhurried. No surprises, no urgency. You may notice your jaw unclenching. You may notice your tongue resting instead of pressing against the teeth. These are signs. The nervous system is resting. Nothing needs to be done about them. If a thought appears about dinner, about tomorrow, about the past, let it pass through without engaging. Thoughts do not require answers. In this space, they can come, they can go. The pacing remains slow because aging bodies respond best to predictability. Fast transitions demand energy. Slow continuity conserves it. That is why this voice does not rush to end. If your breathing feels shallow, that is okay. If it feels deep, that is also okay. Nothing is being measured. This continuation exists, so your system does not feel abandoned by silence. The voice stays until you no longer need it. You might notice that the words are becoming less important. Then the rhythm. That is intentional. Meaning has already been delivered earlier. Now, there is only tone. Tone tells the body, you are safe. And safety, especially later in life, is more valuable than stimulation. Now, we allow this long listening journey to come to a true close. Not because anything is missing, not because something must be done next, but because rest also needs an ending that feels complete. If you've stayed with this voice for a long time, honor that. Sustained attention is not easy, especially later in life, and especially in a noisy world. What you offered here was time, and time is valuable. Before the sound fully leaves, let's settle one final understanding. This entire message about vitamin D, about aging, about the body, was never about fear. It was about alignment. As we grow older, our bodies ask for cooperation, not force. They respond best to consistency, to rhythm, to patience. Whether you change nothing, or whether you make one small adjustment, you are not behind. There is no race. There is no failure here. Health is not something you catch up on. It unfolds gradually, just like this voice did. If you choose to revisit any of this information later, do so calmly. If you choose to speak with a doctor, do so confidently, knowing you are informed and attentive to your body. And if you choose to do nothing at all today, that is also acceptable. Rest is not avoidance. Rest is part of care. Now, bring your attention gently back to where you are. If your eyes are closed, open them when it feels natural. If your body feels heavy, take your time moving. There is no need to hurry. This narration is complete. Nothing more is expected of you. You may sit quietly for a moment, or continue with your day. When it feels right, thank yourself for listening, for caring, for staying present.